your email. And
Right.
so, periodically I'm getting the same thing, and I'm just, doing my email address and my town email password. And then that sets you up for another month or something. That's a totally separate process. But if you're using a town designated thing, the security things have increased.
Yes. Have you given your phone number as your, to be authentic? So contact the help desk and ask them if they have your phone number on record, because they may be forcing you to authenticate. And if you give them your phone number, again, this is a help desk thing, that might do it. But the only other thing I can think of is that,
no, Jenny, they have my phone number. They still are now,
Okay.
asking you to reinsert your password. I'll say it's monthly. It could be more frequently than that.
Okay.
It
All right.
just seems that, but yes, you're correct. They ask you for your cell phone, so that they have another way to authenticate us.
Okay, so we'll take this offline. Jeff, why don't I send an email to the help desk and I'll copy, we'll try to see if we can, get you some relief with this thing.
So far, it hasn't actually kept me out. It tells me it was an incorrect password, and then a few moments later, the screen blinks and I'm admitted. So, I'm not. It hasn't really been a problem. It just gives you a moment of apprehension. 2 minutes before a meeting is to start, and I'm being told I have a wrong password.
Jeff,
Okay, I just see Caroline's. Should I bring Caroline up now or wait until her item comes up?
She's going to be right at the beginning. So why don't we bring up Caroline now? That would be great. Thank you, Jen.
Okay, Caroline, I just unmuted you, and and I see Leslie as well. Sorry, we got kind of sidetracked. So I'm going to promote Caroline, and here comes, Leslie Moriarty. We're finding you. Okay.
And we're going to say something before?
I'm sorry?
I thought Andy was going to say something before.
I was going to suggest you go to the town website and use remote access and just click on the link there, and you might be okay.
Okay.
Yeah. And when you're coming in from a browser, if you're logged into your Zoom account as well, it just helps everything, it makes everything more.
Thank you.
So is Leslie
I think everyone's up. Just let me know when you want to start recording the meeting.
Yeah, I'm here and I can speak.
Okay, so you're fine, Leslie? It says you're a guest. I'm not sure what that means.
I was just promoted. Oh, I don't know.
Yeah, everyone's a guest unless they're a co-host. Is anyone going to be presenting documents in today's meeting that needs to be a co-host?
I don't. There's a possibility.
Okay.
Of Public Works. I think everything else.
Okay, so I see Jim in the audience. We can bring him up later, I guess.
Right. He's going to come up later. So,
okay.
should we begin the budget committee meeting today?
Okay, I'm going to hit record.
You're going to hit record. So it's 10:32. So I welcome everyone to the budget committee meeting for November. And once again, we have our budget committee members with us: Leslie Moriarty, Jeff Raymer, and Andy Deuce. This is Andy's first monthly meeting with us, so we welcome Andy to our first monthly meeting. He was with us for a special meeting at the end of last month. So our first item on the agenda is from the health department. We actually have two agenda items, HD2. So it's the approval to use a PHEP grant, and we have Caroline Baisley, department head, with us. Caroline, is there anyone else you would like brought up for this?
For this grant?
Is there anyone else that you would like with you to be brought up?
No, I'm by myself.
So
Everybody
great.
else is working.
Well, that's good news. So thank you, Caroline. So if you could just run through what you are presenting today.
Okay, today the first grant application is the Public Health Emergency Preparedness Grant in the same amount of as last year, $43,311. Actually, it's the same breakdown practically as last year. $38,843 would be the actual salary, and Social Security is $29.72. Mileage is $348. not quite sure whether or not we'll spend that. We didn't spend that last year because of COVID, and I don't anticipate probably very late in the season next year, we may be able to get out to in-person meetings. Office supplies is $144. Notices and advertising, that's for recruitment, and it's usually recruitment mostly, because we do recruit at least once or twice a year for our Medical Reserve Corps, and that can be covered under this grant. And printing and binding, that's limited amount of money for some of the the public health emergency preparedness information that we get out to the public about making sure that they're prepared for an emergency and so on and so forth. So the whole grant is $43,311, and I think that the outline is very specific.
So does anyone have any questions on this? Jeff? Jeff Raymer?
Yes, thank you. Yeah, Jeff Raymer speaking. So now we've had the experience of COVID. Caroline, can we get a sense of what this person is doing in a tangible sense? What are their tasks? What's their impact upon the experience that we had with COVID over the last 8 months?
Well, he's the one that's putting together the COVID, which will be used to vaccinate our essential workers in government, and also help us out if needed in the community once we start vaccinating the community for COVID-19. So he also is taking many of our patients. We, as you know, we are in the red zone in terms of the last 2 weeks. We just turned red on Friday, which means that we have a lot of cases per day over a 14-day period of time. In fact, we have, I just got the, let's see, it's 18.3 case, 18.3 cases a day here in Greenwich alone for over a 14-day period of time. So we're watching that very, very closely. We had a week ago past Wednesday, we had 65 cases. From Wednesday to this Friday, last Wednesday to the last Friday, we had 37 cases. And over the weekend, I think we had over 30 cases. So we're really racking up our cases at this point. The Public Health Emergency Preparedness Coordinator does take cases for monitoring, not only for contact tracing, but also for monitoring our patients. So we have about more than half the department moving forward with this effort. I am working with all of the schools exclusively so the staff can take the rest of the influx of patients that are coming in. We understand from federal officials that this time is going to be, those last 2 months of this year are going to be the worst ever. It's probably going to be worse than the spring. And Fairfield County right now is almost all in the red zone. And I think there's maybe one town of the 14 towns that's not. So we are feeling the brunt, all of us are feeling the brunt of this virus coming back for the second wave. And it's also doing a number on our hospitals in the state of Connecticut. So the governor is well aware of what the situation is. He did kick back phase 3 to phase 2. And I won't be surprised before Thanksgiving, we have more restrictions on top.
So going into, as we go into these couple of months that are anticipated not to be particularly good, tangibly as to this person, the task he's principally doing is setting out a plan for vaccinations, assuming that the news from Pfizer comes to fruition, et cetera, which I'm sure we all expect and hope it will. But his principal task going forward is to try and set up a protocol for doing the vaccinations? Is that principally what he's going to be doing?
The plan itself, working with the region to do a plan. Each coordinator in the region works with the group to set a plan up. We have demonstrated our outdoor vaccination clinic plan during the influenza season. We held a drive-through down at the Island Beach parking lot, which was very successful. We will use that site as well. We're very hopeful that some of our medical providers in the community will also take vaccine. There's no guarantee that they will. And when the H1N1 influenza pandemic hit in 2009, only some of our medical providers took the vaccine to vaccinate the community. So we're very hopeful that they do take it, because the health department obviously can't do 3/4 of 63,000 people.
So the cost of this part-time, permanent part-time emergency preparedness coordinator, that's fully paid out of these funds that are coming in the grant. There's no town money being sourced here.
No.
Is that correct?
Actually, we have 15,608 in our budget. We had it last year, but this grant pays back the town for the money that they have in their budget, in my budget. It was last year and the year before. That was the first time we ever took the money. So, and the reason why I put it in my budget is because this grant doesn't come until November, and we need him on board continuously throughout the year for his hours. So in other words, our 15,608 that goes into my budget this year and will go into my proposed budget will be paid back, and does get paid back by this budget.
So
Grant.
those funds would be returned to the town, and the
They
40
do.
and the
Yes, they
43
do.
the 43,311 is the whole cost of his activity for us.
Well, whatever we don't spend in this budget, it goes back to the state. So it's a pay as you go. In other words, you demonstrate what you have spent, and we submit what our report of what we spent, and then they reimburse the town. And so I don't think we sent back too much money, very little money this year. But I can tell you that the money that was in my budget for him, starting in July, which really lasts until November, got paid back to the town. So it's no cost to the town for his work with us. The budget, this grant pays for it fully.
Okay. I have nothing else.
Thank you, Caroline. Does Leslie Moriarty, do you have anything?
Just to
On this one?
expand, Jeff made me think of the question. Does this part-time individual also deal with the volunteer medical corps and the organization of that effort?
Yes. He's the one that set up all the medical people to come and vaccinate in our influenza. He is now organizing and getting people on board to actually vaccinate for COVID-19. So it's been very successful in working with them. He sends out all of the notifications. He sends out the testing. He has to test to make sure that they're going to respond in the event of an emergency. So there's a lot of things that he does as the coordinator to ensure that we are ready for an emergency to the best of our capability.
Does that corps primarily just get involved in the implementation of the vaccines, or have they been advisory to you and your staff in terms of?
No, they just, there are some doctors that are very much involved with us, who are volunteers, who offer whatever services we need. But they're basically, they're a core, they're a medical reserve corps of individuals that assist with whatever we need with. Of course, the medical end of all of this is to actually implement the vaccination process. And hope that answers your question.
Yeah, it does. Thank you.
Andy, do you have any questions?
Yes, and before I ask, I want to give a public shout out, if I could, to Caroline, because I've not had a chance to do that before. I'm just very happy that you're on our team, particularly this year. dealing with the crisis. So
Thank you.
I'm very pleased with what I've seen from your office. A question, really a follow-up to what Jeff had asked about budget. So you had in your budget for this year $15,000 for this role, but that only covered a few months of this gentleman's efforts. What would have happened had we not gotten this grant for this year?
Well,
Is there any risk, or
that's probably not possible, but I guess
Okay.
if we didn't get it, then the town would pay the 15,608, but then we would lose him in the end of October, beginning of November. And that would be, horrific. So these grants, the next grant I'm going to talk about is the COVID-19. That eventually will go away, obviously, because COVID-19 will be under control.
Yeah.
Public health emergency preparedness has been,
So Caroline, do you want to just start with the presentation of that grant? But before you do,
No,
Debbie-
Stay with this one for the moment.
Oh, okay, that's fine.
But I'm sorry, she was saying?
I thought she was moving to the next
We're pretty
grant.
much guaranteed that we've had this grant since 2003. So with the situation of the United States and all this stuff that's going on, I really don't think that the state of Connecticut is not going to get any money.
And one quick follow-up question: this role, the emergency preparedness coordinator, does he interact with the town?
I'm sorry.
Hold on.
I'm sorry. Active with the town?
He's gonna come back.
Had to kill that phone call. Sorry, guys.
Oh.
Does he interact with the town emergency preparedness coordinator, or is there not an overlap?
Oh, no. He works with the police department, the fire department. He works with Dan. He's the emergency management director for the town. Has nothing to do with the coordinator for the department and the town. So, we've demonstrated many times that there is a coordination when we have to, exercise this kind of effort. In fact, I could have not done without the Parks and Recreation Department, the Department of Public Works. So many departments have helped in setting up that the vaccination clinic down at the Island Beach parking lot. The amount of resources that I needed in order to pull that off. Of course, I was determined to do that because we will have it for COVID-19. I had to make sure it worked. But the resources that came out of these departments in terms of, making sure that I had all the equipment, making sure that, they help with putting it up. I mean, it really showed that the town during a crisis and over has joined, hands to pull things off. And I was so grateful that I had this. I couldn't have done it without them. And he coordinated all of that.
Thank you.
Okay, Jeff, do you have another question? I think we should move on to the next grant if possible.
Well, one more question if I can on this. I think it applies on this one. Maybe it applies also to the next. From the standpoint of having a supply available of personal protective equipment, face masks and this sort of thing, are we now planning a stockpile looking forward to these next 2 months?
I still have some leftover PPE for the doctors in the community that came from the state. In fact, we just started to get some requests last week, knowing that the virus has an uptick in the community. So we've started there's no more supplies coming from the state. So whatever we have left will go to the doctors who are asking for supplies. I mean, all of our doctors are working in the community, or our surgeons are working. Nothing's been closed. They have been heavily affected by some patients who have had COVID-19, obviously because we have community transmission going on, but they are all still operating, and they're starting to need some of those supplies. So they are calling in. So we will distribute what we still have in stock.
So when I have an emergency medical response going on, like we were seeing in March and the first half of April, if I have a similar sort of a crisis process going on late November and early December, is it through the hospital that the supplies that are needed for these responders Is it the hospital that's stockpiling the face masks and gowns and the like, or who stockpiles that? How does that work?
There's no stockpiling going on, but the hospital gets their own supplies for the hospital. Police, fire, EMS, and health all got their supplies over the last several past months for their own organizations. We got the supplies for the doctors in the community that have private practice, that don't work necessarily out of the hospital, but have private practices. So everyone has gotten their own their own PPE from the state through the federal government into the state.
So the supplies for the supplies that come through your office, so to speak, are the supplies for your own personnel, and to some extent you're supplying some of the private physicians for them to use in their own offices. And that's through you, or that's going to
No, the supply that comes to me through the state is not for the Department of Health. We have to purchase our own supplies. Those supplies only are being given to us for distribution to the medical providers in the community.
Do you have at this point under control adequate supply to deal with a surge in late November and December?
Whatever I have is what they will get if they need it. There'll be no more supplies coming from the state.
I'm not sure that was an answer to my question, but I'm trying to get a sense of whether or not you have what you need, what your department has, what your department needs to deal with your department responsibility in December.
Yes.
How about testing equipment? Are you able to get testing equipment?
Testing? No
testing kits?
Testing kits are for medical providers. There are several medical providers in the community that provide testing for their patients, and for mostly for their patients. And then we have a list of testing sites and availability of resources up on our webpage that people avail to if they want to get tested. So there's adequate number of testing sites and testing kits in the community to test people, which we are grateful that we have that availability. It's right here, in our area, including Greenwich. So there's not an issue with testing capabilities.
Yeah.
So Caroline, would you please now, Caroline, go on to your second grant, which is, I think, COVID related here. So I think that we can continue our discussion because the second grant is a COVID grant, and Caroline could explain that to us. I think it's a special circumstances, Jeff, and it's more related to this.
Okay. As long as you have a question there, it's all right.
Okay, so the second grant is a 3-year grant of COVID-19. It's called ELC grant, and it's it's to support the detection, response, surveillance, and prevention of COVID-19. The whole gist of this particular grant for local health departments is to build capacity to help us manage not only the surveillance of it and the detection of it, but the prevention of it and the management of the monitoring patients and doing contact tracing, but also to vaccinate the public. So $58,000 will go, $58,800 will go to part-time salaries for 3 contact tracers. This grant didn't outline a whole lot of choices for local health, because they wanted us to hire people to help us, an epidemiologist or contact tracers. It would be very nice to hire an epidemiologist, but in light of what's happening, we really need tracers. We did lose 3 of our tracers because of the difficulty it is to deal with the state data system. So, these 3 hired folks will help us replenish what we had, and that will be great. So it'll be 24 and a half hours for $25 an hour for 32 weeks, which is what they told us to put in because this grant is late coming to us. And so that it'll be $58,800, and Social Security benefits will be $4,498. So that's a total of $63,298. And then overtime staff, many of the last grant, which is called was called a crisis COVID grant, did pay for all of the OT that the staff had to put in during the spring. In fact, we work day and night, 7 days a week. Hopefully it won't be that bad in the upcoming weeks of this second surge. But it pays for all the overtime my staff has to put in to that as well. And then there is some funding for some office supplies and some medical supplies. We bought supplies to support the outdoor, as you can see from my application, the outdoor COVID-19 vaccination process. We had it set up down at the Island Beach parking lot just recently for influenza vaccination, and it worked out very well. It's amazing how well it really did work. So this grant was very low in terms of how much supplies you could buy. I was really surprised, only because they wanted you to, support your department with capacity. So there was a $5,000 cap, and I got it down to $49.95, 69 cents of supplies that we needed. And so, that's a good thing. We also are going to be receiving, I heard, a grant that will support some equipment, mainly a freezer that has to go down below like minus 91 degrees to keep the COVID-19 vaccine. So we're going to purchase that through that stipend that's going to be coming through, but that won't probably come through until maybe the first of the year. So they're really setting up whatever local health department has capacity to do this vaccination. They know that it's going to be a tough thing to do in every community, but we have to have the tools and the equipment in order to keep the vaccine, obviously frozen, or we have to have a freezer that actually can hold the dry ice, which will keep it below the temperature prior to vaccinating the public. So I think that, again, this is the first of 3. The second year will be the same amount. It will probably look like almost the same. We may have to increase our tracers depending on how things go with this virus. And then the third one is the rest of the grant, which will be like 6 months worth of money. And then hopefully we will be in good shape that everyone will have some immunity and we'll have a good portion of our community vaccinated. And then we can rest and prepare ourselves for an annual vaccination that will handle COVID-19.
So do we have any questions, Leslie?
I just wanted to follow up to make sure I understood something Carolyn just said. We currently have a grant that is paying for the contract tracers that you're currently employing, and that is, you're at the end of that grant money, and this will come in and allow you to maintain. Do you currently have the 3 on contract tracers?
No.
How are you handling contract tracing right now? Let me ask.
No, but we have volunteer tracers and my staff. Again, we had like 6 volunteer tracers. We lost 3, maybe 4. We didn't hire these tracers. I can't afford to hire them now until I get the money from the state. And so, and they're in desperate need right now. In fact, there's one person who I may bring on as a volunteer who does not want to get paid. It's just it's a tough situation right now in the middle of a pandemic. In the rise of number of cases, I'm concerned that we're going to be in, that we have enough, but I've added a couple of my staff to do that. And as a result, we've had to kick back, obviously, what we're doing in the department. I mean, I can't have business as usual with the influx of these cases. So my main concern right now is to take care of the public and to manage this COVID-19 pandemic. And then after that, we'll talk about how we're going to go forward. But right now, that's the main thrust of this department.
And do you have, I don't know what the hiring process will be for these people, but I would assume that you are.
Good morning, everybody, and welcome on this rainy day. Let me begin by reminding you that you can access the RMA meetings and future speakers by going to our website. That's greenwichrma.org. We have 50 programs a year, and one's just like the one that you're participating in this morning. And when we're not meeting in person,
Up a program, something they did not have in the spring, that if you can't handle your cases locally, that it goes to the state. The only problem with that is they just do contact tracing and then they kick the person back to you for monitoring. So we still have the need to monitor our patients as they go through these 14 days of symptoms. We found in the spring that many of these people are still on a nervous wreck. When they start to get sick, they don't know what it entails, and neither do we until we start to monitor them. Some people fare pretty well with it, and some people don't. And those people that start to go downhill during our monitoring, they end up in the hospital, and of course they get good care there. So we're very familiar with the process now.
Do the tracers monitor the patients, or is that?
Absolutely, yes.
The tracers
All
do?
the tracers do.
All right. Thank you. That's all I have.
Jeff, I think you had your hand up.
I did, thank you. The overtime expense, what largely is generating the need for that, the 47,000 and change?
It's a 7-day operation, and a lot of these, we just have to call them every day. Some of people don't get called every day, they get called every other day. And I'm not going to say everybody gets an evening call, but a lot of the people do get weekend calls because of the nature of how many people we have. Right now, I've held the line right now because there's no money really for overtime for my staff to do that. So myself, since I'm the only MC in this department, have been making calls over the weekend to like critical patients until we can get this grant and get money for some overtime. It's not a lot of money. We blew through about $45,000 in the spring. The unions, most of my staff get time and a half. We try not to really make any calls on Sunday because that's a lot more money out the door. And my people straight time in the event of an emergency. And of course, our emergency situation nationally and here in Connecticut has not lifted. So right now I'm holding the line, but I don't know how much more I can hold it at this point. We're getting way too many cases.
So the 47,000 is mostly being incurred for the monitoring process. Is that what I understand?
Well, the contact tracing takes an awful lot of time. The data system that the state set up is like War and Peace. You wouldn't believe it. I think it's a great system. It was designed perfectly, but it takes time. You have to put things into the computer. These people are sick. I couldn't imagine when we did it in the spring. We did contact tracing, but we did it the whole fashioned way by asking questions and writing down what are all the things that we needed to do. Now we have to put all this stuff into a data system, which takes time. That's really the issue here. I mean, it just takes a lot longer to put this stuff in.
And the process of purchasing the personal protective equipment and face masks that your department needs or has to supply to others, that's the $3,942 and change?
No, that's personal protection equipment. we have for us, we buy through the family health program, our medical supplies. We have enough for ourselves. We're not going anywhere. This has all been doing on the phone and by Zoom and that nature. We don't go anywhere. All this is done by computer and by phone. So, but we do have enough to pull off our vaccination clinics, not only for ourselves. So this amount of money is going towards the office supplies, the equipment that we bought, that we're going, some of which we bought and some that we will buy for the outdoor COVID-19 vaccination program. We have to purchase coolers for the vaccine. Once the vaccine goes into these coolers, it starts to defrost. We had to buy a couple of these kind of transporter, coolers. They're special kind of coolers. We did purchase a few of those and try them out down at the influenza clinic, because again, there's no electricity down in a parking lot. So we have to be prepared in order to, in order to accept this vaccine. Once it goes from the freezer to these coolers, it starts to defrost, and at a certain temperature, at that point, we can administer the vaccine. So we did buy some of that. We bought some canopies. I don't know if anybody saw our setup, but we had tent-like structures for the cars to go underneath. Well, everything was done, in the car. Nobody got out of the car. So we demonstrated that we could do that as well. So this is no PPE here, no PPE here for anyone, and no PPE for us. All the PPE that goes to fire, police, they all have their own PPEs that they picked up from the state. They'll be getting no supplies from us.
Thank you, Caroline. Andy, do you have any questions?
A couple. Caroline, I assume that no portion of the first year's allocation of 115,000 has already been budgeted. There's no return of budgeted monies by getting these funds.
But budgeted by us? No.
Yeah, okay. Unlike
this coming all from the federal government.
Right. And but it sounds like the initial year's allocation will help refund some prior expenditures you've incurred this year. Right?
Yeah, so they'll cover all of it.
Okay. And have you been running at the run rate that's implied by the 115,000 for the full year allocation? Or
I'm sorry?
The $115,000 for the first year's period that ends in 6 months.
Right.
But basically, you've been making expenditures already this fiscal year. So it's going to be a relatively even run rate for you in terms of funding, or is it kind of front loaded?
Oh no, some of the expenses will be posted. Has already been posted to because we still have some crisis COVID-19 money coming in, and again, we have to submit what we spent, and that will be covered by that grant, and then whatever we didn't spend on that grant will be covered by this grant. But
so let me ask the question a little bit differently. What have you spent already this year that will be reimbursed by this grant? What
we spent was some office supplies, which was which actually was rolled tape that we had to tape off the parking lot with. We bought a card scanner, which we demonstrated that we can actually take a copy of a Medicare card in the event that we get on overload down at the parking lot. We
well, I was more in terms of
dollar
expenditures.
Medical coolers.
But what portion of the 115 is already spent this year? Estimated.
Maybe 500.
Okay.
I mean, the bulk is for contact tracers and overtime. We have spent no overtime because we have none to spend.
So
this is great. That's great to hear.
Yeah.
So Caroline, we want to thank you very much. I think for many of us, it's discouraging that the town branches turn red, and thank you for the additional information you provided. Thank you for everything you and your department are doing in this very difficult period of time. We appreciate all your work. Do I have a motion on HD2? And is this routine? Jeff?
Yeah, I would make a motion that we approve this item and recommend it to the BET for its approval. I would make the same motion on HD3 if that's appropriate at this time, Madam Chairman.
And both, Jeff, as routine items or non-routine?
I think both can be routine. The only question is whether or not some of the other BET members have questions for Caroline to avoid the necessity for Caroline to have to get through our BET meeting.
Okay, so I see Andy's hand up. Did you put that up before, Andy? And then
That was
you
an old
continue?
hand, but since I'm speaking, I'm happy to second Jeff's motion or two motions.
Oh, okay, great. And so, so these are two motions to approve HD2 and HD3, both as routine items. Those in favor, Ms. Moriarty,
Yes.
Yes.
Mr. Raymer, Mr.
Yes.
Deuce,
Yes.
and that vote is 4-0-0. And we thank Caroline for
Thank you.
everything that she's doing at the moment. And, you know, I would also like to add that I was someone who used the clinic in Old Greenwich, flu clinic. It was fabulous. It was clean. It was safe. It was just amazing. And also just to see what was happening, I did go to the special flu clinic in Island Beach at about 11:45. It was so organized. It was really very special. It was only some, you know, Greenwich and our department head in health, Caroline Baisley, can do. So I thank you both for that.
Thank you.
So we move now to ED4, the BOE. And Jenny, can we pull up Sean O'Keefe? And I just want to see if there's anyone else, Sean, that you would like to have joined you, and you want to make some comments here?
Sean, could you please
Can
unmute
you hear me?
yourself? Should I bring Sean up to the panel?
Yes, please. I don't see any. I see Dr. Jones. Sean, would you like to have Dr. Jones brought up too? Why don't we bring up Dr. Jones? Thank you.
Hi,
Superintendent.
everybody. Yeah, I think Tony's on, so you can bring her up too.
Yeah, I asked Jenny if she'd do that, please.
Thank you.
So Sean, do you want to give us an update, please?
Should I give you the nickel version since almost everyone heard it?
I think that would be great. And also since, quite frankly, we're running quite far behind,
Okay.
not that this isn't very important too.
Okay, very quickly. So our request is to restore 2 additional headcount that were taken down since 2017. So we used to have 85 custodial headcount supporting our buildings. That's in 2017, it was reduced to 83, a reduction of 2%, 2.4%. During that same time frame, square footage has increased by about 100,000 square feet, about 6.5%. And as I mentioned on the call with HR committee, there are industry standards as far as number of custodians per square feet. And right now we're at about 19,482 for every custodian, which really compares poorly with industry standards. The top standard is 16,625 per custodian, and the mediocre standard is between 17 and 18,000. So we're below the mediocre standard at this point. Overtime, we spent over the last 4 years $500,000, in the range of $500,000 per year. It was 647 3 years ago, and in 1920 we were down to 308 due to the physical closure of the schools. Much of the overtime driven by, coverage for vacation, sick, and FMLA. And as I mentioned earlier, the real issue is to restore headcount to levels that we had several years ago, and COVID has only exacerbated our problem. So we really do need additional staffing. Some would argue that we need more than just 2, but 2 is what is our request for now. As far as funding goes, we estimated about $64,000 between salary and health. So the total requested would be about $127,000, which we would propose to offset fully with reduced overtime and continued transportation savings that we're continually looking at.
Thank you. Do I have any questions on this or Leslie?
Yeah, I wanted to kind of make a couple of observations. First, based on the numbers presented here, this is really a request that's not impacted by COVID, in the sense that we're looking at overtime before COVID that's significantly higher than the cost of adding these 2 custodians. Now, we don't know whether overtime will still be required, and I'm sure some overtime will still be required, even adding those 2, but we're hearing Sean telling us that he believes that custodian would be reduced by more than the cost of these 2 employees plus their benefit costs, and that he would be able to journal voucher the cost of the benefits for these 2 employees to the town, so that for the fiscal 21 budget anyway, the town's side expenses would not be impacted by this change. I think the numbers here definitely justify the headcount increases. I know some of the concerns raised in the HR department had to do with potential impacts from COVID, in the sense that if the building shut down and maybe we do able to cut back a little bit on the required cleaning, what flexibility do we have in terms of deferring the hiring of these people or furloughing these people if they're not necessary? And those are outstanding questions, but they're temporary ones, and we're asking for a permanent decision here. I also heard comments about, well, let's defer this to the February budget cycle. And to me, that rings kind of consistent with the message we were trying to change in terms of interim expenses for interim appropriations for capital expenses. Our departments get very nervous about coming in for interims and always wait for the budget cycle, and that's not always in the town's interest. Here we're looking at continuing an expense item that would exceed what it would cost us if we hired people versus using overtime. So I know that there are still some questions that need to be answered in terms of the potential outsourcing temporarily, or the use of permanent part-time people that the town's able to employ, but the Board of Ed didn't have clear responses yet to the meetings and those questions, the HR meeting this morning. But I think, there's a case here that we should not, that's in the financial interest of the town, that's been made by the Board of Ed, and I think that we should consider the request. The numbers look like they're favorable to me, and I would be supportive of it. I wanted to. No, that's all.
Andy, I saw Andy's hand up.
Thank you. And Sean, good seeing you a second time this morning. A question on the history here of overtime. I noticed, as Leslie also pointed out, that it's gone down the last 3 years. On that point alone, why is this request coming in now and not, say, 2 or 3 years ago? And related to that,
had I known about it, I would have raised it.
Okay, fair enough. I also noticed that the hours per week worked by our custodians is, 35 hours or so? And I was wondering if that perhaps had changed 3 or 4 years ago to cause the incremental overtime. That's before your arrival, I understand.
Yeah, 35 per week is what I know. I don't know the history of it. I don't know. Tony is relatively new as well, so I don't think we have anybody that would be able to talk to that right now.
And a third, you make reference in your materials that you submitted to us on Friday to industry standards. What's the source of that?
Let me get that for you. I don't know what the standard is, but I did get that from Dan Watson.
Okay. And in terms of funding source, I'd be hesitant to include transportation savings. It really has nothing to do with the addition of 2 custodians. That's separate and apart, as I understand. Is that fair?
You're completely correct in that it has nothing to do with it. However, it's something that I am continually looking at, finding savings, finding efficiencies. So if those efficiencies can fund, help fund custodians, which we need, then it's all to the good.
And I applaud those efforts. But what's not mentioned here is how much overtime would be replaced by these two proposed hires. You didn't think it could be 100%, but presumably there is some number of hours you could perhaps estimate.
It certainly wouldn't be 100% of the hours that we're incurring now. That's why I said we're going to need probably something more than just relying on overtime reductions. I couldn't begin to tell you how much, but I think between the two areas we can do it.
Ideally, I like to make this strictly a marginal analysis, and if we hire the decision to hire two custodians has nothing to do with transportation. I would look strictly to how many overtime hours we could save through their hiring. Two other quick questions, and I apologize. I was kind of surprised to see the amount of decrease of overtime for this past fiscal year 2020. I would have thought that would have gone up, but I presume that was due in part because of the closure of some of the space that they would normally have had to be cleaning in the spring.
Right. Once we closed, there was deep cleaning going on, but and then the buildings were closed, so there was no need for a daily deep cleaning.
And has there been any change in cleaning protocols since last spring as we come down the experience curve and understanding how how transmission works? Perhaps less so with surfaces and more so with aerosol spreading. Has the procedures changed at all in terms of how the school staff approaches this?
Well, I know we're using Viking Pure Solutions, which is a spray that we manufacture the solution. It's hydrolyzed water, and it's proven very effective for knocking out viruses.
Yeah.
So that's relatively new.
I guess my last question is, or maybe it's a comment. I would encourage you to really consider permanent part-time to address this, and it need not be 4.5 hours per day. It could be 2.5 days per week, and that would address the absentees or filling in a vacancy that's temporary like that. And
Dan is already reaching out to Al, so we'll get an answer on that.
Because I just have a general concern that in a period of declining enrollments, I really feel bad about increasing permanent staff as enrollment picture is not that clear.
Tony, you want to address that one?
Well, I think
I'd rather not get on to another too far away from this, but Tony, if you have a specific, to this particular request.
Yeah, I think it's very much driven by square feet, not enrollment, because if we have 17 children in 20 classrooms or 22 children, the cleaning is the same.
Yeah, I understand.
Thank you. Jeff, you had a question, or has your question already been asked?
No, well, in part they have, and I won't re-ask those questions, but I had a couple of things I wanted to raise. It's worth mentioning that that some years ago, not exactly yesterday, we looked at the question of trying to put together custodial services on the town side with the school side. And it is some comfort to me that when we did that analysis, we discovered that actually on a square footage basis, the school side was handling those custodial services at considerably lower cost than we were incurring on the town side. Now, these buildings are not comparable, and I really don't know whether or not those figures would stand up today. I don't even remember what the numbers were, so I can't make that comparison to the materials that Sean sent to us on Friday. But we were left with the impression at the time that from the custodial services, schools were handling themselves pretty efficiently. I also remember that when we were doing the budgeting this past spring, we were talking about the fact that that surely there'll be some exacerbated expenses as a result of COVID, and we'll be stepping in with interim appropriations to deal with those. We're being told that these two custodians are not purely COVID related, that there is a question of simply handling what the workload is quite independently, but in part it is COVID related. And I regret the concept that there now seems to be resistance to accommodating the interim request when it's being made of us, at least in part. Lastly, I don't react well to this question of, well, maybe we won't approve these, maybe there should be permanent part-time people. In all the departments, we've had the experience that when we reach out for permanent part-time people, you end up hiring people who frankly were looking for full-time work. because they wanted the benefits. And so when you hire the permanent part-time people, they're with you for 3 months or 4 months, and then they find a job elsewhere that is full-time and has the benefits, and they leave. And so what you've done is, first of all, you've put our HR department through the process of processing new employees and just having to do it again later, 3-4 months later. You've also gone through the process of training people to fill in for the task. About the time you get them trained and they're doing the task, they leave you to take full-time work elsewhere. I think to some extent we're beginning to micromanage the school board when we start to tell them that we think they should be doing it with permanent part-time instead of full-time or whatever. I really think what you need to do is let the school board run the school board business. They've come to you and they've said that they need these additional 2 people. They're dealing with a budget that was fairly severely curtailed. I honestly think it's incumbent upon us to be a little more receptive to the request that's being made of us. Speaking for myself, I would support this and be recommending it for BET for approval. Thank you.
Okay, thank you, Jeff, and thank you, Leslie and Andy too. I'd just like to comment here that, we've heard from, in our previous 2 presentations from our health director that Greenwich has turned red. There also have been rumors about the schools perhaps closing down around Thanksgiving and maybe for some period thereafter. Those are only rumors. I would also comment that, for many of you who worked with me for some years, when we bring on these new larger projects, and, I'm not going to just identify the schools, we could start with the public safety building with its marginal 67,000 square feet, or MISA, or, New Lebanon School. I've always asked the question, Nathaniel Weatherall's another one, again, taking it away from the schools. What are the additional custodian, janitorial duties coming with this? What are the additional janitorial supplies that will be needed? What's the marginal cost of doing this? And the response is typically, we can handle this internally, don't worry about that, et cetera, et cetera. I do think that this does, I certainly want all of our buildings to be clean. And again, as I pointed out, this is something I've always been concerned about since I've been on this board. Actually before, because the public safety building was before, and I did speak to it. So I do think that this is an issue that needs to be addressed, and that we need to make sure that our buildings are clean and whatever. It's my understanding we don't have that problem now, that this is being handled very well through our existing custodian staff, be they overburdened, and making additional overtime compensation for this. I also value the excellent suggestions that came out of the HR committee, which did not support this at this time. I'll call it a temporary non-support. I thought there were excellent suggestions in terms of both permanent part-time, which is what the town does do on this side. And I think our buildings, are very clean, like the schools, and it's just a different system. I'm encouraged that Dan Watson has already reached out to Al Manelli. I think, I thank Dan for doing that just since the HR committee meeting. And I think these kind of communications are excellent. I also thought that one of our other HR people or sitting in on that meeting suggested, some degree of outsourcing. That may be more for the period of COVID, but I think that's a way to address the current situation. Again, I think it's being handled well. And I guess, I would tend to, this has been an ongoing issue. This is not a new issue. This is the kind of issue perhaps that Sean and Tony became more familiar with because they were preparing the budget. But to me, this, as suggested in the HR committee, this may be one where the permanent solution is decided during the February discussions. And by the way, at that point in time, perhaps that whatever is decided becomes implemented for the remainder of this current calendar year. I don't want to suggest something, but it's always something to consider. So overall, I do think that I appreciate the work that Sean O'Keefe and Dr. Jones are putting into this, bringing this forward. But at this point in time, I'm going to ask for a motion and we'll take a vote. Do we have a motion? Moved by Jeff Raymer. Is there a second to this?
I'll second, and the motion is to approve
The motion is to approve the hiring authorization of additional custodial staff as it's presented in our package today. I mean, I will add that I did ask for additional information to break down, the sources of the compensation and so forth, by whether it's holiday weekend or whatever, because maybe, we need a different type of staffing here, whatever. Those, we did not yet get those responses, but they only went out, the questions only went out about 24 hours ago. So Leslie, you
Yes,
second this?
I'm going to second this, but I have just a jurisdictional question. If I understand the request correctly, to increase the TOO, but it does not have a budgetary impact in that the Board of Ed can fund this within their operating budget, and they will fund the benefit cost by providing those funds to the town once those employees through journal voucher through for this year. So I'm wondering whether the budget committee is really the place to be acting on this.
Well, I guess we're now back to conversation, but I would make the comment that we've never in the past ever done anything like that. According to Teamsters, I think Mr. O'Keefe did mention a reimbursement for the health benefits, but when we look at the chart that Mr. Geiger gave us, that's attached to the budget guidelines, but it's historic information for the current fiscal year. I believe the cost of a Teamster employee is about 66%. So it's about 100, and using that same sort of salary, it's about $108,000. I think, Leslie, what you're suggesting is a good idea. But I think it takes more work, and we need to begin to think about how that process and recognizing that process. But, I think that the fact that the BOE is now beginning to recognize the fact that it may have to compensate the town for some of these expenses, I think is a very positive thing. And I look forward to further discussion on this. So may I take a vote, please? Those in favor?
No, Ms. Tarkington, let me just respond to that. Only because this is a particular instance where they are requesting change from their budget and therefore covering the cost for this particular year. You kind of are broadening the attribution and the way we're handling benefit costs. And I just want to make sure I'm clear that this is particular to this request and changing the TOO in the middle of the year. Thank you.
Okay, I was not sure whether that would be ongoing for these two people. That was not clarified and was not in writing. But anyway, I agree with you. So I think we can move on and take a vote. Those in favor of Mr. Raymer's motion, Mr. Raymer, we'll start with you.
Aye.
And Ms. Moriarty,
Yes.
Mr. Deuce,
No.
and I too am a no. So the vote is 2-0, and that did not pass. So thank you, Mr. O'Keefe and Dr. Jones. We appreciate your joining us. I think that there's other information requested. And I also, again, I'm very pleased that Mr. Watson has already reached out to Mr. Manelli. That's absolutely so positive. And, this is a temporary, I will call it this, look at this. And, as you know, you're always welcome to come back at any time. Thank you. So should we move on to PD PW2 from the Public Works. And I saw Jim Michael on here before, and I haven't checked. So can we bring Jim Michael up, please? And I don't see anyone else.
He's coming up.
When Jim comes up, he can say if there's anyone else that he would like to bring up with him. I don't see anyone else, though.
Good morning.
Good morning. Good morning, Jim. Welcome to the Budget Committee's November meeting, and you have an additional appropriation for the South Sandwich Road Causeway for $2,500,000. I don't know, Jim, I don't see anyone else with you. Is that correct? I mean,
Just me today. So
okay, no, that's great. I just want to make sure in this Zoom environment we're bringing up any others that should be brought up.
Chief Heavy's hand is up. I just wanted to bring that to your attention.
I'm sorry?
we have actually Chief Heavy and Mark Dawson with the fire department are both on in case we have questions about emergency access.
Oh, thank you so much. Thank you.
I'm going to unmute Chief Heavy, and he can, if he needs to answer a question, he can just unmute himself.
And Mark Dawson also, please. Thank you. Jim, do you want to describe, what's happening and your request? And I will also add that Roland, this morning you received some additional information really fairly lately. And so we do have a breakdown of costs. And, we may want to put up that later, or Jim may just be walking through things and describing. So Jim, why don't you proceed? Thank you.
So around September 14th, we were notified that a portion of the South Sandwich Causeway had collapsed on us. It was about 55 feet. We went out, we looked at it from the top of the road, which is what we could see, and made the determination that for safety purposes, the causeway needed to be closed. Since that time, we've been working with engineering firms and others to determine several factors involved in this, what repairs need to be done, what currently exists out there. Some of the questions came up with ownership of the causeway as well. And we're at a point where we feel that we would like to proceed with moving towards a repair of the causeway, which will be a more permanent repair and meet the ability to feel safe running emergency access vehicles across it long term. This would be a full repair of the causeway. What we would be looking to do is basically build a small wall on the outside of the existing causeway that will support it, pretty much the entire length of the causeway. And that would be on both sides of the causeway. We found there's a significant number of voids underneath the existing causeway and wall that in order to maintain the integrity of the structure, we think that is necessary. The voids are primarily because of gaps in, they have the stones kind of intertwined amongst themselves, but there's just space where water can flow between the north pond and the south pond, as we call it, of the reservoir. We've been working through this as a kind of like a design build type approach where we can try and get the design done, and in the meantime getting a couple prices from local contractors and talking with one of our contractors that we use for other highway maintenance items. He is doing some work in the area and may have a amount of stone that may be coming out of another project that may be beneficial to us for cost. So we're thinking if we were able to utilize that contractor, that may actually reduce some of this cost. But these are all things that as we work through this, we continue to take into account. Because another factor is we've had some drought conditions this fall. so the reservoir is fairly low. That is beneficial to us because having to build a cofferdam or other structure to keep the area dry in order to do the construction would just be additional cost. And the lower the reservoir is, the lower the height of that structure would need to be. And so we've been working with Aquarian as well to make sure that they can maintain that water level at a lower rate because of it being the winter time frame. People aren't watering their lawns, which or hopefully you're not watering their lawns. And therefore we can utilize that the height of the reservoir as well. Their demand is less during that time frame. And if we're able to do this construction, say December through April, they can maintain that lower level in the reservoir, but need to start bringing it back up for the beginning of April. So those are all things that we've been working through. The request is at 2.5, and if you look at some of the information we provided, we do have a pretty decent contingency on that, which is primarily because of we're doing the design build process kind of here and hoping that as we move forward, we can get this moving forward in a fairly quick manner so that they can be ready for construction in, come mid-December or so.
So, Mr. Michael, can I just have Mr. Geiger put up that cost summary that you provided, or maybe the picture and the packages you provided? I think was around.
I mean, if you want me to, it looks like Jetty made me a co-host, so I can actually share my screen, and I got this stuff kind of the packet that I sent you. If you'd like me to do that.
Yeah, just very quickly. So the other BET members, I think Roland said it, but we really didn't have time before the meeting. There was another meeting going on too. And so can you just quickly walk through it? I mean, you mentioned the contingency, So
this is kind of the space where it collapsed. You can see normal wall here, and then you can kind of see that this is what's underneath there. It's just a lack of better terminology for the layperson. It's a big old pile of rocks that has a road on top of it. And so there is a section that collapsed here.
So may I ask a question? I'm going to ask.
Yep.
So when you talk about building another wall, is that going to be on top of the existing stone wall that we see there? Is it separate? And do you have any kind of schematic or picture that we can look at, or that other residents can look at who live in the area for the aesthetics of it? Because as we found in the bridge at Bruce Park, many people in Greenwich are also interested in aesthetics.
Yeah, I have some information, but I will get to that here in 2 seconds.
Okay,
that's
great.
Okay.
That's fine.
So this drawing here, the 2 orange lines would be the approximate location of the new walls that would be, and it would be infilled where the road would be. We wouldn't be widening the road at all. It's just for schematic purposes, I showed them a little bit further away from the existing walls than what they actually would be constructed, but that's kind of an idea.
Thank you.
If you look here, you can kind of see these 2 blue areas. That's how the new wall would be constructed. So they would be directly adjacent to it, kind of covering the view from the water. The water line is down here and the road is up here. So it would basically be filling the inside of that. It would be a similar dry laid stone wall. So it would have the same look and appearance as what's currently out there.
Thank you.
That's the extent of that.
Thank you.
And then I can zoom in a little bit on this here. So this is that cost estimate that we put together, that when you get down to the bottom with the contingencies and so forth is around 2.5. And that's what we came in asking for. There's a couple things in here as we were going through it. We said, we may be able to do a little bit of it internally. And that's why if you look at the very bottom, it says 2.57, but we just said 2.5. We think we can make it work. Plus you have the pretty large contingency percentage. So
Thank you. I mean, I just thought since you had sent it in, but it was, quite late, that perhaps my colleagues hadn't seen it. And so I wanted to make sure that it was. So I guess my next question is, do we have any questions from, I can't see it at the moment. Maybe you could pull down that screen or at the moment,
Yep.
Mr. Michael?
Yep, I got it.
Thank
There
you.
go.
So do we have, I assume this is the end of your presentation. Do we have questions, Mr.
That's all
Raymond?
I have for now. So I'll
Thank you.
answer questions.
Jeff? No,
You're
Jeff,
muted,
unmute
Jeff.
yourself. Unmute yourself, please.
Yeah, sorry. Thank you. In your presentation, you said something about there being some ownership issues. What was that?
So initially there was a question on whether or not the town owned the wall or Aquarian owned the wall because it's part of the adjacent to the reservoir. All the answers that we came back with was that the town owns the wall. We went back through any legal documents, and it all references ownership of the Aquarian going up to the highway on either side when the Aquarian acquired it, which means the highway was there before any ownership was taken over. So that's that question. Some people had asked us that question. We were 99% sure, even going into it, that we owned that because it is a town road. But we just wanted to make sure, and that's the answers we got.
Are there any outstanding permissions that you're going to need from Aquarian to do the work that you're having to do? And the follow-up question would be, do you have those consents?
So we have had a couple conversations initially with Aquarian. We will need their approval. We'll also need the Connecticut Department of Public Health approval because it is a public water supply for doing this. They have had actually an initial conversation with the Department of Public Health. Because everybody is considering this an emergency operation, we feel that that can be moved through the system fairly quickly. We don't want to move it through that system fairly quickly until we know that we're going to be able to move forward with this. And that's kind of the pathway we're taking here, with making sure we have the funding in order to move through it, because the alternative solution is probably to consider doing this if we were to go through the normal budget process, getting the money in July and then going out to bid after that, potentially looking at doing this the following year from now, which that would leave us in the same situation we are today, but a year from now. We don't want to raise too many red flags with people until we've gone through that, but we don't think it's going to be a major problem getting those approvals.
You mentioned in your presentation also that you were considering one particular contractor who's doing some work in the area and has some stone available, which might assist in the cost. Have there been any conversations with Aquarian regarding any plan they might have to dredge or deepen the reservoir to improve the capacity? They've had a capacity issue there for some time. My thinking might be that there too might produce the availability of some rock in case there's a serendipity here that this work might be connecting with some more immediate plan of Aquarian to be doing some deepening.
I don't believe that we haven't heard that from them. They haven't mentioned that to us about about dredging this to make additional capacity. I do know that several in talking with them without, being part of Aquarian, some of their capacity issues have been more moving water from one place to another. And they are working on various projects to move water from various other reservoirs that they have, especially in Stamford. That actually is the project that we're looking to obtain this stone from, is the line that they're installing, a new permanent line they're installing between the Stamford Reservoir and this reservoir. So we can ask that question, but they did do recently some significant work to the dam at the south end of this pond and setting the connection to the lower part of to their Putnam Lake, which is the other side of the Merritt. And so I would think that if they were to lower this pond for additional capacity, it would just they'd need to redo some of that work to connect that into their other lake park project. So.
And the last question regards timing. You wanted to get this through the BET for the purpose of having it be possible for you to take it to the RTM at their December meeting. I think they meet also in January, but they don't meet in February. But you're keen to get this started so this not to lose this period of time while the water is low and can be kept low. Is that the point?
Correct. Basically, in talking with contractor and our design consultant, both of them have told us it's probably a 3-month or more project, or ballpark 3-month project. So that even if we start, if we got approval the middle of December, by the time we get everybody geared up in the holidays, figure January 1, that gives us all January, February, and March. Plus you have weather in there, which doesn't make it any easier, especially in the middle of the winter.
So you're likely to have cooperation from Aquarian on keeping the level low. If you started in January, it was 3 months, January, February, March, through the end of March. Or are they having to start to refill before that to anticipate the spring usage of the water?
They've told us that they would need to be really starting to kick into refilling in the beginning of April timeframe, because it isn't a quick thing to fill that size of a reservoir. It takes a significant amount of time. So,
thank you. I have nothing else.
Mr. Deuce?
Hey, Jim. Andy Deuce. Thank you for all your time and attention on this. I have several different sets of questions, but first on timing. I went to the Aquarian website to look at the historical averages for reservoir heights and levels in Greenwich. And typically it's 100% in the wintertime. And the period of lowest water levels is August through December. In your note to us, you said you're more concerned less about level, but more about water use, which I think that was perhaps a misstatement. We'll get to the urgency to get this repaired, but in terms of absolute levels, I would think the summertime would be the best and optimal period to do this, everything else being equal.
So the reservoir levels, or the needs for their levels, are highest in the summertime, and therefore their demand is highest, and that's the difference. My statement between demand and reservoir levels, what they tend to do is they tend to have the highest demand in the summer months because of the heat tends to be drought and so forth. They want to try to get those reservoirs up to the highest level between December and April so that they're starting as high as possible. However, what they've told us is if they were to start filling this in April, they're willing to work with us on this. We did this a couple years ago when we installed the couple dry hydrants that are right up on the same exact section of the reservoir. And they allowed the water level to be down very low, to even lower than it is currently, which allowed us to be able to do the work up there. So
they have the ability to manage the level, but just so everyone knows, historically, the low period for water levels is August through December, not in the winter months when it's typically full. Right now, it's about 33%, but I imagine over the next couple of months, particularly as we shut down local water usage, they'll start to refill. Before I go back to the project, I would like to hear, maybe take I'd like to hear from the police and the fire representatives who are here on the call to get to share their thoughts on how urgent it is to have these repairs be made and how necessary it is to have this particular causeway available to their vehicles.
Thank you, Andy. So thank you, Andy. So I will call on Police Chief Heavey, please. Jim, you.
I think we're still good morning. Good morning.
Good morning. Yes, we can. Thank you.
Greetings from the marginal 68,000 square foot building, the public safety complex. I reviewed the concern we had for this, and our look at it is that it's a considerable increase in response time for a long period of time. And it's, if you look at that particular section of town, the fire station number 8 is on North Street, right at the Parkway, and that the police cars, which are car 56, 57, often use the Parkway as a access and GEMS to get east and west above the Parkway. So again, to get that road back open would be a positive thing, because otherwise going to North Stanwich or down to Taconic or down to Dingletown, if an emergency vehicle gets off the Parkway in their effort to respond quickly to an incident, may increase the response time by several minutes, which again, as you all know, that response time is a very important key factor in success at an emergency.
Chief, is it also possible for the fire trucks to ride on that road? It's a one-lane road, and do they have the ability to access that road?
Well, Andy, we also have Mark Dawson on the line.
Sorry,
He
I
can
didn't see
separately
Mark
answer.
there.
Chief Hebe, have you got any further comments, or shall I bring up Mark Dawson?
No, that's fine. He could certainly address the concern about the apparatus, because they're both larger than the ambulance and the police car. But again, we were up there the night that the event occurred, and we have noticed a response time increase in that area. And again, you can't look at it just the 7 or 8 roads that are on the other side of that bridge. That's an important thoroughfare east and west for emergency vehicles that are utilizing the Parkway. And you can only imagine South Stanwich, if any of you have been on that road, is much more of a direct route than North Stanwich or Dingletown or Taconic to access that area of town. So that's all I have, subject to your questions.
Thank you. Mr. Dawson, do you want to make any further comments here?
Sure.
Please.
Good morning to the committee. Appreciate the opportunity to speak on the item. Station 8, as the chief mentioned, was put in that location to be able to access across to the South Stanwich, through the South Stanwich Causeway to Stanwich Road, the upper section of Stanwich Road, and Taconic, along with Stag Lane, Sky Ridge there. And with this down, our response times have increased 4 to 5 minutes, depending on weather and traffic. So the South Stanwich Causeway for us and our department is a crucial link to fire protection in that quadrant of the northeast and eastern boundary of the Stanford Greenwich line. So we are extremely concerned with this road down for the fire protection in that area.
Thank you, Mr. Dawson.
Thank you.
If there's one more thing I can add, I did get a email from Patrick O'Connor from GEMS, and he kind of just made the same comments. He said that their response comes from their Medic Station 3, which is at Lower Cross near Parkway School for that area, and that utilizing South Stanwich is very important to them as well. So
Thank you.
Thank you, Chief.
Leslie, can I continue here?
Yes.
Thank you for those thoughts. Getting back to the project itself, this is a massive project. Many thousand tons of rock and fill. I just wonder if we're putting in good money after bad. You mentioned in your notes that some of the water flow goes through the rock. There's no, not all of it goes through a separate culvert or whatnot. And I was wondering, in my experience, when you have water flowing through a foundation, it's not good and it weakens it in the long run. And perhaps could that have been a contributing factor for these number of voids that you mentioned that you found when you looked more closely at the structure? So I guess my question is, should we take this as an opportunity to actually build some sort of small span, or to allow the water to more easily go from the upper section to the lower section?
So when it comes to the overall length of this causeway is about 500 feet. And we looked back at how that this causeway dates, we see aerial photos from the 30s we think it actually probably dates to the 1890s when when the water company put in the dam on the lower portion of these ponds. So it's been there quite a while. When you start looking at making it more of a impervious versus pervious, where water can either flow through or not flow through, because of the length of it, the cost would be significantly higher, and it would be a significantly larger amount of work to rebuild it completely and make it all impervious where water can't flow through. It also would probably have a decent impact on how the water flows between the two reservoirs. It kind of works and serves as one main reservoir now. And I think that based upon the advice we've gotten from our design consultant and talking with Aquarian, there are things that water is going back and forth between them isn't always the best thing. But in this case, we feel that the design can be accommodated for that to be flowing back and forth between.
So with the construction of the two new walls, it's not an opportunity to make them impervious. And you have somewhere in the midpoint a large pipe to allow the water flow from one section to the other. I just know from prior experiences that where you have water flowing through foundations, it's not good, and it does create voids.
Yeah, I think with the engineering piece of it, and with it being more just the interconnected rocks, that it will still serve that purpose. And water flow, you'll have groundwater probably seeping up in between no matter what, unless we were to rebuild the entire thing, which would be a very significant cost.
So, Ms. Moriarty, do you have any questions, or you're fine?
I did want to follow up on a couple of things. Was this particular roadway and this bridge on the Public Works plans for inspection? I'm just wondering whether this is a typical roadway that you would have normally put in monitored.
So we do monitor these retaining walls. We do keep an eye on it. What we found is retaining walls are very difficult without significant testing to find out what's going on behind them. And there wasn't anything in the past that indicated that this might be coming, but we are trying to continue to improve our monitoring and inspections of retaining walls. It's not considered a bridge. It doesn't have an opening large. It may seem strange, but it doesn't, sometimes we get these culverts that are 5 feet wide that are actually considered a bridge that require us to go through the bridge projects or bridge inspection program. But this retaining wall that's 500 feet long doesn't require the same requirements of a bridge for some of those things. But it's a new program a few years ago that we put onto the Capitol for our retaining wall maintenance. We have 91 walls and counting, retaining walls in town. We keep realizing we have more. And as we find them, we put them onto our inventory. But, we used to kind of just fix and maintain these through highway maintenance. But we noticed between the Pemberwick Road wall project, and we've had a couple other ones recently that have been more costly, that we think it's something that we need to start looking at and taking more into consideration. So.
And I noticed for this particular one, certainly you took the correct action. The wall collapsed, you closed the road out of an abundance of caution. The WMC evaluation, just because it wasn't clearly the results of their work weren't clearly presented in the documentation you gave to us. I mean, they concur that this project needs to be completed. It needs to be completed quickly, and the road shouldn't be used until the work is done. Is that the bottom line assessment of their work?
Yes, the assessment is that they concur with our opinion that traffic should not be on the causeway until repairs are made.
And what would be an estimated lifespan, for lack of a better way of phrasing it, of this repair? Once it's done, I know that you can't guarantee 100 years, but what would you expect as far as needing additional work? When would you have it on the program?
So I think this would be, the work that would be done would be intended to have a lifespan of 50 to 75 years, kind of similar to our bridge expectations. What we've ended up seeing is a lot of times with proper maintenance, we can make them stretch longer. There hasn't been a significant amount of maintenance that has been done to this as far as we're aware, or as far as our other than repaving the top of it and adding some guide rail to it. So knock on wood, the hope would be that it would last potentially another 50, 75 or more years.
And you've worked with Aquarian in terms of gaining their support for addressing this project, and they'll work collaboratively with us.
They seem to be at this point continuing to work collaboratively with them. We haven't had like I say, I have a weekly conference call with WMC, and they've been working, on this stuff and providing us data as the time comes. And just in the past week or so, we've had the most recent, this is what we think it is. This is about how much it's going to cost, which seemed to time right into your meeting and so forth. That those drawings that you're looking at that I shared just a few seconds ago, I got at 9:15 this morning from them. So I apologize for not having them any sooner, but that's that's how we've been working on this one, is trying to continue to move it forward as quickly as we can.
No, and I think this is one of those projects when we talk about interim appropriations that it's certainly relevant to bring it to our attention and ask for the approval. I know that the cost estimates that you've given do carry a higher contingency than many projects that typically come to us, but that's because you are in the early stages of the design and determining the need. But, hearing from our public safety experts that we have a delay in response time, not having access to this road and the condition of the road, it seems like an appropriate action for this board to take to move it forward.
So I see hands up again. I think I'm going to ask a question and then I'll come back to the others. Jim, I know in your memo you indicated that there's no bridge funding resources. Is it worth pursuing, since this was built over 100 years ago and it's the equivalent of a bridge? It's an emergency, and it's certainly something that's critical to the infrastructure of the town of Greenwich, as I think Leslie has been pursuing here. Is it worth? Is there some little innuendo here in our bridge construction financing program that will allow this? Because it's really substituting for a bridge. You advised us that a bridge would be prohibitively expensive. So this is my question for you, Jim.
So it does. With a lot of I think what I'm hearing your question, if I'm understanding it correctly, is could we make the argument that it is a bridge and get some funding for it that way? And
correct.
There's such strict guidelines on what things qualify for which bridge program there is out there, that this one would not qualify for that, for those programs, because those programs are to maintain existing bridges typically, and they're not for which this wouldn't fall into that category. So.
But 100 years ago, this was the best solution, and this is a repair of 100 years ago. So I understand that, but if there's any way you can further pursue this, just as a way to bring in additional financial resources, it would be appreciated. But understand that this would have to be approved without this additional resource. But if you could continue to pursue it,
We're happy to
I-
ask the question. Yes, we're
That
happy
would be
to
great.
make some
Thank-
phone calls and see if there's anything there. So,
Thank you. Mr. Raymer?
So two things. First, Mr. Michael, on the materials that you sent out this morning, the last page that has the breakout of the figures comes through to us very small, and I don't know when I try and print it out if it'll come out to be large enough to be readable. Could I ask that you maybe resend just that last page on the slightly larger size? The other question I have is really more a Roland question, and that is the funding source for this appropriation, Roland. You're not completing that item. What are you going to be showing as the funding source? Is bonded?
Well, the two options right now are either attach a bonding resolution to this or to take it out of capital non-recurring.
So is that something we need or should be deciding at this point?
I think you should, yes. I mean, keep in mind that we have $3 million already earmarked in the guidelines to be used from capital non-recurring as part of the mill rate calculation. So this would leave about $5 million left of capital non-recurring if they both came from there.
And
so Jeff, I thank you for bringing this up because I was going to do it after the questions were, because then that's obviously the next thing that needs to be discussed.
Well, why don't I just defer to you then, as long as it's addressed.
Do you have any other questions?
Oh, just those two questions, yeah.
And Andy, do you have any other questions?
Well, just to make clear, Mr. Michael said that there's no state funding if we repair the current structure. And if we add a bridge, just to confirm, there's no incremental chance for state funding for that. Is that fair to say, Jim?
correct.
Okay. No further questions.
So, so I will go back to the funding issue. So, which I think I sent you all an email since it did not come with funding. We have two choices here. We have a choice of taking these funds from the capital non-recurring fund, and we have a choice of funding this with our normal ban debt program. Mr. Michael has shared with us, I guess, responding to a question from Ms. Moriarty, that the estimated lifespan of the repairs should be 50 to 75 years plus for this particular interim request. So do I have any comments, plus or minus, on the funding source? I can begin with Leslie, who has her hand up.
Yeah, I think that we should attach a bonding resolution to this. This is typical to how we handle most of our capital projects, and it is appropriate to have the longer term funding. I think we want to make certainly we can, during our budget process, we can manage our capital non-recurring if we need to, if we believe it's in excess, but 2.5 million is a pretty big number on that capital non-recurring account that I wouldn't want to make that decision right now just by itself.
Do I have any other questions or comments on this?
If that's a motion, I'd second that.
Is that appropriate to make it a separate motion? I would ask you, Mr. Raymer, who always knows so much about these kind of things. Is it appropriate to make it a separate motion at this point in time?
In candor, I don't know the answer to that.
So why don't we just combine it, since it didn't come with a funding source, with the motion to approve the $2.5 million, unless someone objects to that particular motion. Mr. Deuce or Ms. Moriarty, do I have any objections?
This is for a second. Was that the motion, Leslie, or?
No, the motion was, the question is, would you like to approve the funding source separately, or since this did not come with a funding source, are you satisfied with a motion to approve this with $2.5 million and that it be funded by, because we have a bonding resolution for that 2.5, accompanied by a bonding resolution for $2.5 million.
I'll make that motion and put it on the floor.
Okay.
Yeah, I'd second that.
Okay, so Leslie made the motion, and seconded by Jeff Raymer. May I bring up Mr. Minarski? actually, I see your hand up, Andy, but I'd like to bring up Mr. Minarski and just ask Mr. Minarski, this is an interim, it's for $2.5 million. Is there any additional cost for doing this as an interim? I just want to make sure we have this for the public record. And also, do you have, if you, when you go to a bonding in January, would this be part of that particular bond, or would it be moved off to, say, January of 22? Can you just give us any color to this particular motion and the funding of the $2.5 million?
If this project is bonded, first you'd have to change the vote on the blue sheet. It becomes the B fund, not the Z fund. Z fund indicates a source coming from capital non-recurring. The additional cost would be the band cost in year 1, year 2, and then the interest in borrowing in January of 2023, and then there'd be the slight financing costs from the credit rating agencies, the Robinson and Cole in the finance. But that would be minimal because it would be buried in with all the other projects in a $30 or $40 million project. So the short answer is it's the borrowing financing costs that are in addition. If you went the other route, the cost would be the foregone interest that you could have earned by having $2.5 million in the capital non-recurring fund, which right now is very minimal.
Thank you. Thank you, Mr. Minarski. So are we ready to vote on this? Mr. Deuce, did I see your hand up?
Mr. Bernarski answered my question. Thank you.
Okay, so we're ready to take a vote. Those in favor of the motion made by Leslie, Ms. Moriarty and seconded by Mr. Raymer, with a change to, and Mr. Raymer and Ms. Moriarty, do you agree with a change to the fund being the B fund rather than Z fund?
Yeah,
Will you change the motion?
That was implicit in Mrs. Moriarty's motion.
Okay, thank you. Okay, those in favor, Ms. Moriarty,
Yes.
Mr. Raymer,
Yes.
Mr. Deuce,
Yes.
and I, Ms. Parkington are also yes. That's 4-0-0. Thank you very much, and thank you, Mr. Michael. And we wish you all the best with your design build project, which is an important thoroughfare. I see the traffic coming in and off of that road all the time on North Street, so I'm very familiar with that road. We're bringing up now PD3 for the police department, acceptance of a gift, and we're bringing up Chief Heavey. And is there anyone else that you would like to bring up with you, Chief?
Sorry, he's on his way up. He'll speak once he gets on the page.
No, just me.
Well, that's an important me. Would you like to explain what's happening here?
We have a local resident who is making a donation of 4 electric bicycles to augment our already existing bicycle patrol. As all of you know, we have had additional responsibilities in providing safety and security for both Greenwich Avenue in the areas where there is vehicles are not permitted, and also additional responsibilities at Greenwich Point and at the other parks because the parks are getting used a lot more since the pandemic. So this individual is donating 4 bicycles and all of the accoutrements that are required to make them emergency bicycles. And the total donation will be valued at about $19,044. There is, I know that sometimes it's a concern of the VET, about a $700 maintenance that will come up about the end of year 3 because we're buying the warranty service for these bikes to keep them in service. We already have a number of officers who are trained, certified bicycle police officers who can operate the bikes. And if you were at Greenwich Point, there were over 2,600 cars at Greenwich Point just on this past Saturday. Bicycle officer down there patrolling that area. And I haven't gotten the number yet for yesterday, but I suspect it was even a larger number. So subject to your questions, I realize that it is as it is explained in the attachments.
Thank you. Do I have any questions from anyone? So I'll take Mr. Deuce first. I saw his hand first.
This is good to hear, Chief Evie. How big is our current bicycle fleet, and how many officers do we have certified to be the bike riders?
Well, we have a bunch of bikes. They're probably, some of them are nearly 20 years. So some of them were bought before I was a sergeant. So we've been kind of like, changing the tubes and the tires, changing the batteries for the sirens. So of the 6, we've kind of put together 2 or 3 of the regular bikes. And then we probably have at least a dozen officers who are certified as bike officers. The state does require that. And our work right now is to get an officer certified as an instructor, so it'll make it easier for us. But we've gone to SUNY Purchase. They have an officer there just over the line who's certified as an instructor to do a class, and we'll be certainly adding to that. One of the challenges is that people get promoted or they get assigned to other areas of responsibilities. So they still have their bike uniform. They're still certified, but not always able to deploy. So that number will increase once we sort that out. But there won't be any additional ask for training in that area.
You mentioned also that we have a payment for the warranty. Just to be clear, this is a donation of cash to buy bikes, or it's a donation of the bikes?
No, they're going to provide us the bikes. So
we're buying the warranty, right?
Correct. They come with a extended warranty. The Panters, the bike bags, battery, the hitch for the police car so they can get down to the point, and the light and siren package. So it's
okay. So all of it's being donated in kind.
Yes, sir.
Okay.
Any other questions? Mr. Raymer?
Yeah, it might be a question more for Pete. I was concerned about the anonymity of the donor. Have we had prior experience of donations anonymously like this, and most particularly donations for material for the police department?
Is the question regarding someone being anonymous?
Yes.
Roland has more history than me. I don't recall. I know there was a vehicle that was that came through the drug asset forfeiture account, but I'm not aware of it. Maybe Roland might be.
I don't know how anonymous they become, because this is going to have to go to the RTM for approval as part of their gift policy.
Well, I mean, it's before the BET. I mean, I don't know why that's
exactly.
Different. It would be anonymous, I guess, at the RTM too. I'm not quite sure why I have the concern. It just makes me feel a little uncomfortable to have the anonymity. And oddly enough, don't take offense at this, Chief. But
I already have. So it's too late.
Okay.
I'm already offended.
My car is being booted as we speak. Somehow, when it would bother me a little less if I thought there was an anonymous gift being made of some material for the Department of Public Works. Somehow, when it's police, maybe even fire, it concerns me a little more. I want to be sure that things stay transparent. Has there been any discussion of this with the town attorney as to whether or not this is whether or not there's a concern here? I wonder if perhaps the town attorney could be consulted before this comes to the full BET a week from today, a week from this evening. Might that be a possibility?
Sure. I think in my effort to make sure that it didn't have any appearance of impropriety, I don't even know who the donor is.
Okay.
This is somebody who's a resident, and they sought out the Combined Organization of Police, which is an agency, which is a 501c3 that provides the police department occasionally with equipment or donations for different things. And this one's, it exceeds the guidelines of $5,000, so it has to go through the process. But I will consult the town attorney and make sure that, and if you want, we can try to vet the donor, but we may lose the opportunity. I'm not sure. I guess I don't know who it is or she is, so I don't really know.
I mean,
it's certainly hard for me to give them any extra treatment if I don't even know who they are.
Yeah. Well, I mean, you'd think I would be only grateful that somebody's prepared to step forward and donate nearly $20,000 to the town, or $20,000 of equipment. And I am grateful. I mean,
We don't often look the gift horse in the mouth in a very nice way here. We don't.
And I have a reluctance about that. I just don't want to be clumsy and do something. So that I wouldn't mind maybe if the town attorney could be asked, maybe be asked also the corollary question about whether or not there is, to pick up on what the chief just said, some vetting that's appropriate. Maybe the person has an existing relationship, maybe a pending case or something of that sort. I wouldn't want there to be an awkwardness. I would just like to ask the question so that we haven't been unworkmanlike about that. And that said, whoever is that donor, if he's listening out there, I don't mean to be ungrateful. I'm just trying to be thoughtful and careful.
So, Mr. Deuce, is that question on this same subject, or if it's not, can I just ask you to wait?
It's related. If we're going to be asking the town attorney, I'd be curious to know if we're required to approve this, because it's an in-kind gift, not a cash gift. If that makes a difference, whether or not we need to approve it.
That I would worry that would be a precedent setting. May I ask Mr. Minarski a question on the same topic? Mr. Minarski, does the town have to comply with the federal money laundering laws the same way the private sector does? Do you know that answer to that question?
I'm not sure I understand the question.
Does the town have to comply with federal money laundering laws, parallel to what the private sector has to comply with federal money laundering laws, which would include, again, I'm not current on them, but say gifts of over $10,000?
I don't know the answer. I would defer to Mr. Marino.
Okay, so Chief, can I come back to you? I see you've disappeared on us, your voice.
I'm right here just listening.
So would you please, at the same time you're pursuing Mr. Raymer's questions with Mr. Marino, also ask him about, and make sure Mr. Minarski is involved in this too, the federal money laundering laws, if we're required to, and if we're required at a certain amount to do any particular due diligence or disclosure. That would be very helpful here. And please keep Mr. Minarski involved on this too.
Okay.
Okay. So are we ready to take a motion on this item?
Hand up. I don't know whether.
I'm sorry, Leslie, I didn't see your hand up before.
I just wanted to clarify, because there's a lack of, or not a common understanding about the acceptance of gifts. And I'm not sure this is really Chief Heavey's responsibility to ask the question. It's more maybe Mr. Minarski's or just the BET members in general. But clearly the BET needs to authorize expenditures of $5,000 or more that are not included in the budget. This is a non-cash gift. There's no expenditure to be made. It's just accepting a donation. And so I'd like to try to settle once and for all what the BET's responsibilities are here, whether we even have a say in the acceptance of this gift per the charter or not. And perhaps, I don't know if Mr. Minarski is the right person to ask the question, or whether, it's Mr. Mason, Ms. Tarkington, someone to get a declarative opinion from the town attorney on our scope of responsibilities with these gifts, because it comes up periodically.
So I'd be happy to work with Mr. Minarski. I see Mr. Mason's hand is up, and why don't I call on Mr. Mason, please? Our chairman. Mike?
Go ahead.
You always got to unmute. First of all, introduce Ms. Moriarty. Thank you. This is a hard gift, as explained. If you go to our BET reference manual and you look up gifts, you're going to find out that our authority is to create an appropriation, and it is solely the responsibility of the legislative body of the town of Greenwich to accept gifts. This item, had we been given the cash to buy the bicycle, then the BET would have had to opine on that. We would have created an appropriation subject to the approval of the town accepting the gift. It's very clear, and I would say we've been asked this question I'll give you all a side note. The first selectman is working right now in trying to deal with public-private partnerships to try to get everybody on the same page to understand how gifts work and and I'll use his words, to maybe streamline the process. And there's a couple things that that can be done for that. But in this particular case, I don't believe this is an item of the BET. I don't believe the BET opines on the acceptance of gifts. We only create appropriations as it relates to gifts. The questions that you have are good, but those are questions that you should forward to your RTM representatives when it comes before them for them to answer. Thank you.
So Mike, are you saying that this should not have come to the BET?
I would say that as I see the current request from the chief right now, he's asking to accept hard gifts valued at X with no financial implication. There's nothing he needs to, once he gets these gifts for 3 years, he's not spending any money. He doesn't have to do anything. He doesn't have to have naming rights. There's no financial implications on this to the town right now. So I don't see where the BET has to opine on this.
See, Mr. Geiger has sent through the gift policy. Is that correct, Mr. Geiger? I didn't look at it. Did you send something?
Yeah, it's the gift policy. I think there's 2 different decisions on there from different attorneys about the gift policy.
Thank you. Okay. So do we have a motion for I'm sorry?
I think what we're being told is that this is not a gift of the funds, it's a gift of the material, and that it's not an item for action by the BET. So there is no motion required. I think the item is being withdrawn, no?
Is the item being withdrawn, Chief Eby? I want to make sure that if you...
Not, I would think that it'd be important for transparency and accountability that it be reviewed by your august body. And even if you don't vote on it, then I can report to the RTM that I got all the good questions out in front of this, and I'll address the legal issue with the town attorney between now and next week's RTM meeting.
So, Mr. Raymer, based on those comments?
Well, I mean, I don't see how we can vote on approval of a gift in light of what we were being told. I don't know that I want to do that. I mean, I think I certainly am thankful for the receptivity of the chief to say that he'll speak with the town attorney to get an opinion on this, so the chief can say to the RTM in due course that I was cued about this when I was talking to the BET, and I had a fulsome conversation with the town attorney. The town attorney says it's all fine. That's a perfectly great thing. I just don't know that there's a motion to be made here. If this is not an item under the gift policy that we have standing to approve, I don't want to approve it. I don't want to take a vote on it.
So is there another way of doing it? I'm making a motion, and then just each one of us abstaining. Again, this is discussion. This has not come up before this meeting, and I'm asking for guidance from the committee. You, as a lawyer, and Ms. Moriarty.
Yeah, just one thing. I don't know where I come out on this yet, but I'll throw out this idea. So the BET doesn't have standing, if you will, if we agree with the 1996 opinion of the then town attorney on acceptance of gifts. The BET it's essentially a sense of the meeting, right? A recommendation that the RTM approve or not approve this, since we've talked about it. The concern that I have is I'd like the response about the appropriateness of the unidentified donors to gifts. And so while, as Mr. Raymer indicated, I'm very appreciative of gifts to the town, I think there should be a policy or an understanding on the transparency of these gifts. So I don't think I have the information yet to know how I would vote to support the request. But, circling back to where I started, it would clearly be it is a recommendation from the 4 of us on whether we think the RTM should or should not accept it. And it's sort of a weak motion.
I wouldn't, I mean, I'm sorry, I raised my hand.
Oh, I'm sorry, Mr. Raymond. Yes, please.
Yeah, I mean,
And this-
I think this should be simply treated as a discussion item that came before us, and we offered the comments that we made. And I don't think we should be making, we don't do sense of the meeting resolutions at the BET normally. I would like to avoid doing more sense of the meeting resolutions. I don't want to add a lot of qualifications and only darken the picture for the chief. It's a nice, generous thing that's being offered, assuming that it receives sanction from the town attorney. Let the chief take it to the RTM, which is the way it's supposed to be handled. He can reflect that it was discussed at the BET as a discussion item, and we made a couple of recommendations and thanked him for getting this beautiful donation available to the police department. I'd like to leave it right there. I don't think it requires a vote. I'd rather not vote on it.
Super. So let's move on to.
I just want to be super clear about something. Chief, you were very clear with us that this is not a case in which the funds are being offered to us and you require an appropriation for us to spend that gift. This is, you've said
No money touching my hand. The person is going to provide us the bikes fully ready to go. So it'll say lease on the batteries, lights, siren bags, and an extended warranty so that the town would have no additional expenses to have this valuable asset incorporated into our current bicycle patrol.
Will the warranty be available to the maintenance agreement and warranty be available to the town if the town was not the initial purchaser?
Again, I'll verify that part. Perhaps the town attorney will have some warranty expertise as well. I'll check.
Okay, well, thank you.
So, Mr. Deuce had a question.
Yeah.
One final question.
If I could ask if you would call on Mr. Mason, please.
Oh, I don't see his hand up.
Okay, so by the way, I'm Chief, I just want to thank you. There's another big push coming on in town, and that's why this is hitting. If you go to the opinions that Roland just sent us, in the first opinion, it's very clear. It's really clear. They're giving an example of a $900 gift, and it says that the BET and the RTM have to approve it. The RTM would authorize the acceptance, and the BET would have to approve the appropriation. So that's receiving cash. So I agree with that opinion. But if you go to the second opinion, which I've had these opinions for a couple decades, and you go to page 3 of that opinion, it says a different situation arises if the gift is not of money, but of something other. So, for example, a donation is a fence or a statutory park bench. In this case, the donor still has to determine whether an appropriation would be involved. Okay. But if there's no appropriation, it says not required and only the RTM approval. So the opinions are actually sort of consistent. And I think what happens is people get confused with, is it cash or a hard gift? For instance, the Board of Education right now, their internal workings, they really don't want hard gifts. They would rather get the cash and buy the bicycles if this was for Board of Ed. They would rather do it that way, so that follows that process. So I think these opinions are fantastic. And by the way, I'm saying this more so because I think we as a BET are going to be having this conversation more in the future. I think there's, not because of us, I just think some of the things that the Board of Selectmen are working on. So I think this is a good conversation for that. But I think the opinions are consistent. And if the chief was being handed a check to go out and buy these particular bicycles, that would be a different situation. But I think, I think the report back to the RTM is that we looked at it. We don't see an appropriation. Therefore, we did not take a vote. Exactly like Mr. Raymer's saying, exactly the same thing. But I think from the chief's point of view, having go to the RTM, I think the chief is actually going to be helping us get the RTM to understand how we understand the gift policy and the gift practices. Thank you.
Thank you, Mr. Mason. So as I said before, why don't we move on to new business? Mr. Geiger, we didn't have any economic conditions in our package because our meeting is so early this month.
Right.
It was originally planned for next Tuesday and the information. So can you just give us an update? And
the revenues are still being posted, and I'll have something later on in the week that I'll send out. I really don't have anything right now just because it was so early this month.
Right. Okay. Thank you. Do we have Miss Moriglio? Can we bring her up, please? Heather, are you there, and can you unmute yourself, please?
Oh, sorry, I'm promoting her to panelist. I thought you wanted her.
Good morning. Can you hear me?
We
Yes.
can. Welcome
All
to
right,
the
that's
Budget
great.
Committee.
Thank you. Thanks for inviting me to join the meeting this morning. First of all, I just would like to start with providing the BET with the delinquent real estate amounts we collected after a first time ever mailing in March. It was directly after COVID. We did a mailing probably around March 4th before the COVID got as crazy as it did. And we collected about $2.2 million in the month of March alone. And I just wanted you to know that even in the midst of the pandemic, we were able to process every check that came in by mail the same day and deposited it the same day at TD Bank. And also at the time, the Greenwich TD Bank was closed. So that meant traveling to Stamford and waiting at the drive up every day. But we did it. And I just want to let you know that the staff here is tremendous, and I'm thankful for them because of the dedication and the commitment that they've shown to our town. In regard to the landlord deferment program, we had a total of 40 applicants. We had 35 commercial properties and 5 residential. And I'm happy to report that each property has paid, and they've paid on time. We also recently, October 11th, we had a delinquent 2018 motor vehicle mailing. And to date, we've collected just about $84,000. This was also helpful with the assessor's office, because what happens is if we don't have people coming in and saying, I no longer own this vehicle, there's time constraints on providing the proof to the assessor. So the 2018 mailing was super important because those people only have until the end of this year to provide that documentation to the assessor. Let's see. Okay, in regard to the 2019 versus the 2020 collection periods. Let's see, for the same time period, now we're talking about the July 1st time period through October 1. The 2019 collection, which was last year, was 212.4 million against 206.1 million as the first installment goal. Now this year, we had a goal of 206.2, and we collected 209.4. So if you put this into ratios or rates, the collection rate for 2019 was 103, and the collection rate for 2020 this year was 102, which to me is a tremendous achievement given the times we're living in with COVID-19. Did you want me to continue on to the delinquent, or did you want me to answer any questions in regard to the collections?
Why don't you finish your report, and then if there's any questions, Heather, we can just you can handle them, or however we do it.
Okay, sounds good.
Thank you.
So moving to the delinquents, we have approximately, 7 properties that are nearing the 15-year cutoff. We have 2 at 13 years, 3 at 12 years, 1 at 11, and 1 at 10 years. Out of the 7 properties, I spoke with the assessor's office, and they were able to provide me with reports on the vacant land, which out of the 7, there are 5. And out of the 5, 4 are not desirable parcels of land, but there is 1 that would be favorable to see about moving on. And I didn't know how in depth you wanted me to discuss each property.
I think this is fine for this discussion, Heather. I thank you so much for coming to the meeting. But obviously, if there's questions, I see Mr. Raymer's hand raised.
I knew Mr.
then-
Reamer would have a question.
And then we'll then you can address them at that point in time. But what you've done is terrific. Thank you so much, Heather, for joining us.
Leslie.
Mr. Raymer?
First of all, thank you, Heather, for the effort that you were going through. I mean, traveling to Stamford to be making these deposits and things. We do fully appreciate the effort. I'm glad to see this office running as efficiently as that. I am concerned about these delinquencies, and I'd like to focus some attention on the delinquencies. I don't have the access that you do, Heather, of course. Actually, I think if you'd be willing, I wouldn't mind to ask if you could do a computer run off of Quality Data Services of exactly which are the accounts on which there's a delinquency of more than 10 years, or I should say different 10 years or more. As I was rummaging around some tax accounts, I came up with a list of 5 without any expectation that I was complete. And my list of 5 only overlapped with your list of 7 on one, the first one that you list. I'm pretty sure that you were given the tax account numbers on the ones that I had raised. I had asked our chair to do so. I think actually it was the vice chair that forwarded it on to you. So I know you have the same focus that I do. But I am concerned that we not allow receivables like this to go fallow, to go uncollected, or if a decision is being made not to collect in these items, I'd like to be thoughtful about who makes that decision, because I think maybe that's a decision that should be at least discussed, maybe decided at the BET. On the 7 that you had provided to us, some of them are properties of modest value. But I don't want to talk about the names of people at a public meeting. I want to refer to just account numbers if I can. On the first one, where you're showing a balance to us of just a tad under $133,000, the assessor is showing that as having a market value by their assessment work at $713,000, just shy of $714,000. So I would say that's an eminently collectible item. The second one, where you're showing a balance of not quite $13,500, the assessment has a modest value on that of only about $3,600 market value. The third one at $190,000, almost $191,000, the assessor is showing a value on that of $1,145,000 and change. And so it goes on that I have some where the indebtedness is larger than the value of the property, but I have quite a few of them here in which the value of the property far exceeds the amount of the indebtedness. There was a conversation earlier on with the firm of Pullman Comley. It's a very fine firm here in in Connecticut. I believe it's the firm that was initially hired to act as town attorney, the firm that Vin Marino was associated with. But whether Vin Marino's there or separately as he is now, it's a very fine firm. And they had undertaken to do the collection on these, large ones and small ones both. And if I understood correctly, the way it works is there's a fee paid on the collection of 15% of the amount that's collected, and that's paid by the debtor. It's over and above the recovery.
That's correct, yeah.
Pullman Comley was prepared to take all of these and force them all, doing the small ones that don't compensate very much, in return for which they were also being allowed to collect the larger ones where they were being paid the 15%. And so I'm inclined to make the following request if I can. I'd like to ask that you do a computer run off of QDS of all the accounts that are 10 years old or longer. If that can be brought back to us at the BET meeting next Monday, that would be great. If not, perhaps at the December meeting or whatever, but soon. I don't want to leave these things go too long. And let's make a decision with your collaboration, Heather, of perhaps doing something to bring some enforcement of these. Again, I don't like the idea of losing funds. When I was doing the little bit of search that I was doing, it's a much more halting search than you could do with QDS. It appeared that we had some accounts where the indebtedness seemed to be dating from 2002, which is beyond the 15 years. The sums may have been small. I can't distinguish from the tax collector's website what the individual years of indebtedness. I only knew what the total amounts were. But for example, on the account number 04-2228, there's a not quite $70,000 indebtedness to us, and some of it dates, if I was understanding correctly, back to 2002. I had two others that dated from 2005. That's 061418 and 063028. They're butting right up against the 15 years now. Maybe even part of it has run. And there again, I don't know if the amounts that were at 15 years were very small or if the whole indebtedness was that. I can't tell that from the website. But I'm very reluctant to leave these things uncollected. And so I'd like to be doing something as a BET in collaboration with the tax collector's office to focus on these and decide what we're going to do about it, so we make a deliberate decision that doesn't just happen by accident. It happens by way of our making a thoughtful, considered policy on it.
Well, I have reached out to Vin Marino on these. I have not heard back from him as of yet. So that I'm waiting on.
And so I want to correct Mr. Raymer on one thing. Mr. Raymer, I don't believe, unless it was a long time ago, that our town attorney was at Pullman Conley. I believe it might have been, was it Cohen and Wolf maybe?
Oh, I'm sorry, my mistake.
But you know, perhaps earlier in his career, he was there, Mr. Raymer.
Then let me at least say, as a doddering old retired attorney, that Pullman Conley is a well-respected, large law firm in Connecticut with offices.
We don't. I'd like to move on to the next topic. We don't need to talk about individual law firms.
Excuse me, before you move to the next topic.
I meant back to Miss Moriglio. I just meant not a topic of this particular law firm. That's what I meant, Mr. Raymer. Do you have any other topics that don't talk about particular law firms?
I'm not endorsing any other law firms today. Would it be possible for you to do a run off of QDS in time for the BET meeting on Monday of the accounts that are 10 years or more delinquent?
I can try to do that for you. Unfortunately, we're a little bit shorthanded and we have people on vacation this week, so I can try.
Okay, that's all I can ask you to do. Thank you.
You're welcome. And like I said, I have reached out to many on these, on the accounts. One of them happens to be having service by our Human Services Department. So
I don't think we need to get into the details of these kind of things at this meeting, Heather, but I'm appreciative that you're highly knowledgeable about them.
All right, thanks, Leslie. Is there any other questions?
Mr. Deuce?
Yeah, Heather, thanks. I don't think, if you circulated something to the committee, I don't think I received it because I'm a relatively new member. So these numbers were new to me.
Okay, I can send that to you, Andy. I think I have your email.
So the 7 properties that are more than 10 years, at least the ones that you had identified, what's the total dollar value that's owed to the town, and what part of that is due to the incremental penalty fee that we would charge? And
I'm showing about, let's see, total due is about $717,000. There's one property that's over 300. So, you know, a lot of them are little small things. As far as interest, it looks like about $359,000.
Yeah, so it's pretty big.
Yeah.
And I guess doesn't really need to be said, but I hope prospectively we'd have an agreed to method or means to remedy to address these deficiencies before we get too close. And let me ask a question: Is addressing a property that's 13 years deficient, does that give us enough time, 2 years, to actually go through the legal procedures to get payment?
Well, this is my first time at this, so it's a learning experience as far as like with foreclosure and tax sales. I know it does take a certain amount of time. So hopefully when I hear back from Mr. Marino, he can give me some insight into that.
I think
If I
Mr. Minorski has some.
If I can be, if I can be helpful there.
No, well, wait a second,
normally-
Mr. Monarski, you have not been called upon. Mr. Monarski has his hand up.
I just want to Andy, Roland sent the email Friday afternoon. And it's the last page in the package he sent to you, that what Jeff was referring to.
I'll double check. Thank you.
Okay.
So, Mr. Raymond, now you're called upon.
Mr. Raymond.
Normally one satisfies the statute of limitations when you institute the proceeding in court. So one doesn't have to go through the whole collection process within the 15 years. One does have to bring the foreclosure proceeding to initiating it, filing, serving the defendant and filing in court. And that you have to do within the 15 years. You have to leave the lawyer a little bit of prep time, but a couple of months probably would be sufficient.
Well, that's
Thank
good
you.
news.
Thank you, Mr. Raymer. Thank you, Mr. Murillo. We really appreciate your help and information. And obviously there's some additional follow-up. I would like to move on and refer to item number 3, old business. We do have a memo in our packet from the Human Services Department. They have followed up on their previous meeting with us, and this outlines how they have made staff changes and no longer need any additional financial resources as they had requested in that previous meeting with the item withdrawn. So they also have resolved the issues with their external entities, and in addition included some additional information coming in from River House, which is not providing the transportation that, to their, well, because of the COVID, like everything else, their business has changed and no transportation is needed. So that's freed up a little bit of additional funds to the Human Services Department. And that memo, which was very kindly done without any requests by the Human Services Department, was included in the posted package. Any questions on that? Should we move on to approval of the minutes? Okay, so we have 2 sets of minutes to approve in the package. Do we have a motion on the October 8th, 2020 special meeting minutes?
I'll make a motion to approve those minutes.
Is there a second?
Seconded.
So motion by Ms. Moriarty, seconded by Mr. Raymer. Ms. Moriarty? Approval?
Yes.
Mr. Raymer?
Yes.
And Ms. Tarkington is a yes. And Mr. Deuce will be an abstain, right?
Yep.
301 is the approval on the October 8th special meeting. October 13th regular meeting webinar minutes. Is a motion to approve?
I'll make a motion to approve. I don't believe the October 13th minutes were attached to our packet. There may have been a draft posted on the website. I didn't just check that now, but I want to approve the draft that was circulated this morning among Budget Committee members for approval.
Well, it went back and forth. It's circulated last week, but it has been done, and it was posted before the meeting, Leslie, early this morning, but it was posted as a separate item under the packets. It wasn't posted with the original package.
So I'll move the October 13th meetings as amended this morning, not yet posted.
I'll second that.
No, they are posted.
Did you post so you posted the most recent set?
They were posted right after you, yes, correct. They are posted. That's correct.
I'm gonna check while we're on the call, but
well, it's complicated. We can talk about that outside the meeting, but yes, they were posted immediately.
I just want to make sure that what we're voting on is what we've agreed to. So
You can check the posting.
I am I'm going to a web page and there's nothing separately posted on the web page. I don't know that we need to, what the FOI requirement is, whether we need to act on something that's posted or just act on something presented to us, but they're not on the web page at the moment.
Yeah.
So it's complicated. Mr. Geiger can support this. It was posted immediately within the package. I didn't think you could do that. I thought that the original packet, this is the way we've always done it, couldn't be touched after it was posted for FOI purposes. So I asked that it be removed from that original packet and then be posted separately. And if it isn't posted separately, then I apologize because it was originally posted with the packet, but early this morning.
Hey, I'm on the website now and it's only the same pack. It only has the October minutes.
You need to refresh. Can you refresh your browser, please, and see if you see it now? I'm not sure if you just went there or.
I went. Anyway, I don't believe we should be posting it that way. If we change something after a packet's been posted, it should be separately identified.
It is. I can send a link around to because I was training the new person today on that particular item. So
why don't we take the minutes of the 13th and the minutes of the 27th and consider it our next meeting rather than, I'm not sure it's an FOI violation, even if it wasn't posted, but let's not run the risk. Why don't we just consider both those sets of minutes at our next meeting?
Leslie, is that all right? What?
Was that a motion?
No, yes. No, it is, no, Andy.
No motion on the floor at the moment, but that's out of an abundance of caution. That makes sense. We can post the October 13th as draft minutes.
I believe they were posted first thing this morning. It's whatever. Don't worry. Just a second here. You excuse me. Okay. So anyway, we'll handle these at the next meeting. That's fine with me. Does anyone have any objection to that? Okay, so then is there a motion to adjourn?
So moved.
Second. Okay, so Jeff and Leslie, and it is.
Mike is raising his hand again. I just want to make sure that we don't.
Oh, Mike, I'm sorry. I didn't see Mike. Yes, Mike.
Before you adjourn, I need a little help. I'm a little bit. I have an item that two committees have had a split vote, but I know there's some questions out there, and I don't want to forego this item. So let me tell you what my challenge is. As I build the agenda, my responsibility is to put items on there that I think need consideration, obviously coming from committees and from what I feel. In my opinion, and I could be wrong, and this is a combination of information I've got from Mary Pepe and from what I've got from finance, I believe the Board of Ed, and I don't know about the union contract, I don't know what the restrictions are, but I believe the Board of Ed as a department, just like Parks and Rec, in their salary accounts, can swap overtime monies and add permanent part-time staff because there's no benefits. I believe they can do that. I believe they should communicate with the proper departments, but I believe that authority is there. Now, that would be subject to labor contract, which I don't have in front of me to give you that answer. With that said, if I were correct, then I want to make sure the Board of Ed knows that that's how it is and that they can proceed in the current fiscal year, that they can proceed and do that if they see the need to do that, if they want to hire X amount. But I don't know if they can do that or not. And I don't know where the answer really lies on this, but I think we really should have it, because the last thing we want to do in our working relationships is we don't want to give anybody the wrong information. On the other hand, we're not trying to penalize them. I understand all the conversations about adding staff right now, and there was a lot of good dialogue, and I compliment everybody. we're not trying to stop them. We're just trying to have a conversation in an organized method on a major, bigger plan. But right now, if their needs, if they can accomplish that within their budget, reduce overtime and do that, then I want them to know that. I don't want them to think they can't do that. Now, I know they're going to be talking to Al Manelli, but they really probably need to go to Mary Pepe. So as I think about the agenda, it's probably an old business item, but I don't know if it needs an executive session. I don't know, but I think we need to clear this up. I think we're obligated to clean this up. So we're giving the right answer to the Board of Ed, because everything I heard everybody say is, look, if you want to do permanent part-time until we can get to February and figure out where we're going in the future, your square footage and what standards you follow, that's great dialogue. That's the dialogue we as a finance board should have. But right now, if we can give them an answer and say, look, you can do this right now without, it's sort of I don't want to give the wrong message here, and I need help.
Mike, the question I have would be, is a permanent part-time employee part of the TOO? Because the specific resolution that we have does restrict, it does restrict people from changing or increasing the total number of positions in the TOO.
So
I started out, Leslie, with saying I don't know. So
that resolution, I think, is going to be part of the issues you need to consider, or we need to consider.
Okay, so I'm just I'll leave it this way. I'm working on it. So if you have thoughts, you know where to find me. Just send me an email. I'm torn over this because we want great relationships with the department heads so they can understand what our concerns are, short-term and long-term. And I think, I'm hoping that Mary Pepe couldn't give an opinion on this. I'm sure there's probably some language in a labor contract. You can't get rid of a full-time position to hire, but I don't think that's what the Board of Ed's intent is. Their intent here is that they got a mid-budget problem. Can they offset that with permanent part-time to get them through till we decide what we want to do for a standard? In other words, I heard somebody ask, I'll give you an example. I heard somebody ask about what are the standards they follow. Well, it's the IPPA. And in the town right now, just so you know, as an example, these are conversations we'll have in February, but we run 23,000 square foot per cleaning employee. But Board of Eds have different standards. Hospitals have different standards. So those are February conversations. But to give you an example, there is very good information we can discuss in February, but I'm working right now more on the short term. I want to be able to be as helpful to the department as I can and could go from there. So just my 2 cents. So please feel free to email me, and I'll be in town hall tomorrow. I'll probably going to be running this by Roland and Peter for advice, and Leslie and I will be in town hall tomorrow, Leslie Moriarty. So we'll hopefully figure this out, but I just kind of need your help on this one.
So Mike, I think that you're right. It's not in the TOO as such in terms of the budget resolutions, unless there is any kind of benefit that goes with this. And I don't know. What they will do is Social Security. So obviously there's an issue there in terms of, if one should depart or whatever. But I think in terms of the general TOO, there's a lot of flexibility there, but I do not know what the union contract says about any kind of benefit for this particular Teamster union. But, the other thing is, perhaps this is, as you point out, Mary Pepe, a discussion point or negotiating point with their current contract in, discussion.
I think this conversation would be better had not in the pending motion for an adjournment and nobody with us from the Board of Ed. We just take this offline for the moment.
Okay, so we're adjourning at 1:08. What is our, Mike has asked for any input, so we can separately give that to him. Those in support of the motion?
Aye.
Mr. Ramers? Ms. Moriarty? Aye. So this is a 4-0-0, and I thank you all at 1:08 p.m.
Yeah.
Take care.
Thank you.
Have a good afternoon. Thank you.